My name is Gael Valbrin, and this is journal entry number 3. So, a few years ago, I was working as a psychiatric nurse in an inpatient facility. I had a patient who was diagnosed with schizophrenia and had been in and out of the hospital for years. He was always very polite, cooperative with the staff, but he would never really open up to anyone. One day, I was sitting in the break room with him, and he started talking to me about his life. He told me about how he grew up in a small town and how he always felt like an outsider. He told me about how he started hearing voices when he was a teenager and how he was always afraid of them. He told me about how he had been in and out of the hospital for years and how he was tired of it. He told me about how he wanted to get better but didn't know how. I sat with him for a long time and listened to everything he had to say. I didn't judge him or try to fix him. I just listened. I think that was the first time anyone had ever really listened to him. He was grateful for that. After that day, he started opening up to me more and more and our relationship grew. I was able to help him in ways that I never would have been able to if he hadn't opened up to me. If I hadn't sat there with him and listened to him about his life experiences and how it made him feel. I learned that my personal strengths and limitations have a big impact on the provider and patient relationship. I learned that one of my personal strengths is really having compassion and empathy for people when they open up to me. I learned that I need to be open and honest with patients and that I need to be there for them when they really need it. And I also learned the impact of really sitting and listening to someone, their life experiences, how it has shaped them into who they are today. And also listening to their experiences is really what is going to help me as a provider for them to help them get in a better mental state